The same as.
About the same as.
The same as.
I guess the same.
More than.
The costs per employee are $3,300 per year. The U.S. industry on the average is around $2,800 per year.
Hospitalization.
Hospital.
Mental and nervous.
Physicians.
Outpatient.
Our highest increasing cost right now is mental health, and that includes substance abuse and detox programs. Our biggest cost claims are primarily for dependents.
Outpatient care.
Hospitalization.
Hospital.
Hospitalization costs.
Hospitals.
45% of our costs are related to hospitalizations.
I think increasing cost would be a concern to every employer.
Benefits can run about 30% of the base pay. That's a lot of money.
I didn't realize that there was that much money involved.
I think it's a very serious problem.
It's a major cost, and it's a rapidly rising cost. Gold Bond alone spends over $10 million a year for health care.
Since the early 80s, every organization has been looking at this question of what to do about medical expense, and there have been no easy answers.
We know we can't do everything, but we've got to try to control the items that we can control.
The whole subject of what is the right thing to do with benefits, to me, is just part of a much broader process that we've been going through over the last year in looking strategically at the company and where we need to be going.
We didn't want to just go in there and take an across-the-board approach. We wanted to find out really what was driving the cost in the plan and to work on those problems and to have a solution for those. And it's really just an extension of this quality process.
We felt that the best way to try to look at that would be consistent with the spirit of the way we've been trying to look at things over the past year, which is in TQM. And that is opening up the issue to really try to understand it.
We want to get other people involved. We want to get employees involved in the process.
I was amazed to learn so much about where money was spent and how much money was being spent in different areas.
Biggest thing was that I think we actually learned something about benefits.
Number one was through the use of the focus groups, was to go around and to find out what was on people's mind, to open up the discussion and use that interactive process to try to really dig out the issues.
We went out and did focus groups very early in the year just to talk about employee benefits in general. We went to 3 or 4 different plant locations. We went to the Charlotte office.
Over 120 to 130 people, asking them about how they feel about our programs, the benefit programs, the good points and the bad points.
Employees in the first focus groups said, yeah, we understand there's a problem out there.
Everyone participated in a very open and candid and forthright way. And
we didn't know what we would get when we started the focus group process, but it really has helped us make better decisions.
I thought it was very good. It was a good chance for employees to give some feedback to management.
I think it's smart to solicit from the employees. I think we probably don't realize there's limited funds to go around. You might as well get the bang for your buck and figure out where to best spend it.
I know there were a lot of people that did think that, oh, well, this isn't coming out of Gold Bond's pocket. This is money that we've paid into John Hancock. And that wasn't so.
I was astonished, I think, in a way, and I think everybody else was too, because hearing the word insurance, and you don't think about the company being self-insured.
National Gypsum Company is self-insured. We don't buy insurance. We, in essence, pay for every single medical claim that gets submitted. John Hancock, while they're an insurance company, in the same way with Connecticut General before them, they don't insure our claims. They simply pay them, and they write their checks on our bank account.
We all think insurance and you pay a premium and you receive the services of the insurance company.
I was one of those that were surprised that Gold Bond actually pays out the claims.
And there's a good reason why we do that. It's one of the ways that administratively we can help control the costs, because we're not paying a premium to the insurance companies to take on the risk for insuring our group.
That was a surprise. That's one thing I did not know.
A lot of the employees in the Charlotte focus groups really felt that they were saving the company money by going to the HMO. And in fact, really just the opposite is true, because the HMOs tend to take the younger, better health risks that would cost us less if they stayed in our plan.
The most important thing I remember was the surprise most people had in learning about the mechanics of the health care.
One of the things that surprised me the most was the increase in dollar outlay for outpatient care.
Outpatient surgery is a good example of what happens in the healthcare industry when employers change their plans. 3 or 4 years ago, we added outpatient surgery as 100% benefit, because we, like everyone else, thought that if you take people out of the hospital, have a surgery done on an outpatient basis, they go home, you save a lot of costs. Well, that happened for maybe 1 or 2 years. But then the hospitals figured out that they're losing bed days and patients, and the physicians aren't using the operating rooms, so they just jacked up the price of their outpatient departments. And it now costs us more to have it done on an outpatient basis than on inpatient.
People were generally surprised on what was happening.
One of the other surprises out of the focus groups is that employees actually felt they were now paying for their group insurance. And we tried to figure out why. And they told us why, and it's because on their paycheck there's a deduction that says group insurance. Well, what probably has never been explained to them, and that's our fault, is that group insurance is their life insurance.
I was under the assumption that we paid part of the health care cost. I guess I'm wrong.
We really haven't changed those features in probably 5 years. And over that course, inflation has gone up quite a bit. So what happens now is that one doctor visit and one prescription drug gets you up over the deductible. And that's not what deductibles are meant to do. They're really meant to keep more of the manageable cost out of the plan before you get into the co-payments.
I'm not sure exactly how much insurance does cost, but to think that a company's paying that for every employee, you know, it really doesn't surprise me as to what the cost would be.
We know that hospital utilization is still a problem. Even though CostCare has brought our utilization down, we're still having over 50% of our bed days as 1 and 2 day stays in the hospital.
I don't feel that the costs can continue to skyrocket without somebody breaking.
Frankly, if we hadn't had CostCare, our expenses would have gone up a lot higher than what they're going up now, because what we have is utilization going down but price going up.
I would say that the healthcare situation as a whole, the cost associated was very serious because hospitals are charging more.
I've always felt CostCare was there as a resource, that people really ought to use them to find out what their doctors are telling them they need. These are physicians available to us, to each of the employees, to call and to get information from. And it is the most rapidly rising cost coverage in the entire plan.
I wasn't surprised that it has become a very large amount of the dollars that are spent because of the society that we live in today. But I was surprised that the cost had gone up so quickly.
The biggest problem with mental illness treatment is there's a lot of discretionary care. There are no firm guidelines. CostCare really has a specialty unit of physicians and psychologists that manage these cases.
If you are employed by a company, I feel like the company has some responsibilities for your health and well-being so that you can produce the kind of output and the kind of work that the company would like to receive from you.
Prescription drugs are increasing almost 30% a year, which is really amazing when you consider the fact that it's almost all price. A lot of people think that generic drugs have had a big impact in bringing down the price, but that's such a small portion of the prescription drugs that are available that we still have to be concerned about what the brand drugs are costing us. And brand drugs are a monopoly. We've been testing a program through the retiree program that we started last year where we have mail-order drugs for maintenance drugs, which everybody thinks are the bulk of the drugs purchased in a health plan. And then there's a separate deductible for the drugs you go and buy through a pharmacy. We're trying to make as many changes as we can all at once so we can just get this done and get it behind us.
The more people get involved in the solution, number one, the more apt they're going to be to support it, because even if it's not exactly what they think, at least they were considered and consulted on the problem.
Then we know we can get onto some other things that we really haven't been able to look at seriously, like other things we heard from focus groups. We really struggle with the issue of employee contributions. This is something that we've put off as long as we possibly can.
I think that the cost of the health care throughout the United States has just increased dramatically over the last few years, and I think companies cannot foot the bill for the total cost.
We've always tried to have a plan that we could provide to the employees at no cost, but in today's world that's not going to happen. The costs keep going up, and we're frankly out of step with the rest of the industry when it comes to employee contributions. It's standard practice now.
I think it's going to be an impact to people when they hear it, but I think that people do realize that the cost of insurance is going up so high.
Employee contributions are going to be $10 a month if it's just employee-only coverage. If it's employee plus one dependent, whether it's a spouse or a single parent with a child, it's going to be $25 a month. If it's family coverage, no matter how many dependents, it'll be $35 a month.
I think it's going to be an adjustment, but it's like you can't continue to expect the company to put money out, and not, especially if the costs are increasing.
To take a little sting out of the introduction of the employee contributions, we're setting up what's called a pre-tax premium contribution plan, so that that money that is taken out of your paycheck for your premium is excluded from your income for income tax purposes. We heard from the focus groups that there was an interest in preventive care.
It's a good idea. Prevention is always much better.
Discover whatever, maybe take care of it ahead of time before it gets costly to a lot of people.
One of the things that we're putting into the plan for the first time is physical examinations. And starting at age 35, if you haven't got a regular physician, you now should go see one every other year, and then after age 50, every year. And we'll cover up to $150 as regular expenses under the plan, subject to the deductible and the co-insurance like any other of the expenses.
That, to be honest, is one of the reasons I opted for the HMO.
We're adding well baby benefits, where the typical schedule of immunizations for new children is going to be covered as a covered expense.
I think that's wonderful. In fact, being a mother of two small children, that was one of the big factors that we dealt with.
We really see this as adding benefits to the plan, for them to be more informed, better educated, and more knowledgeable about their health care, what they need to be doing for themselves. What we'd really like to do is, we'd like to go to bed at night thinking that we've put enough changes in at this point in time that we can leave the plan alone for maybe 3 or 5 years. I don't know if that's going to happen. The healthcare industry is changing so rapidly that I'm afraid it's not going to happen. This is going to be a continuing process.
We are looking at benefits like we're looking at each and everything we do. Not change for the sake of change, but change to ensure that we will be the best in our industry over the long term.
We don't think we're going to stop the cost of the plan rising. That's unrealistic. But what we've got to do is put a dent in the cost so that we come up at a slower rate and from a lower base.
What we're trying to do is to not cut costs, but to reduce the rapid acceleration.
We're going to have to keep riding with this problem. We'll struggle each time it comes to try to make another change to the plan and how we do it. We'll repeat the process. We'll get employees involved, because I think that really helped us this time.
It made people more aware of what the cost of all this involves.
It gives me a great deal of respect for the company because they value the employee's opinion. And I think anytime you include the employee's opinion, then you're going to have a consensus or an acceptance by the employees as a whole.
I had a very good feeling when I left because I felt that people were being very open and giving their concerns and what they felt needed to be done.
It taught us a little bit about the mechanics of, how Gold Bond handles the health care.
I didn't realize the enormous cost of it all. And I've never been exposed to anything. I mean, the company will say, well, the cost has gone up, and but gone up from what to where. And now that I can see how much it's costing the company, I guess that's probably the most enlightening thing.
You can't let your heart rule all the time. And sometimes you would like to think that the company you work for has this deep pocket that is never ending, but in reality that's not the case. And if we're going to continue to grow, we're going to have to look at every item that we spend money on, whether that's the raw rock or whether that's the benefits.
Thank you.